This is my physiological and psychological responses for sports injuries. So, starting off with physiological responses, here on the screen is a diagram of the process that happens when an injury occurs. So, physiological responses refer to the body's physical mechanisms that respond when an injury takes place. Causes of inflammation, accumulation of fluid surrounding the injury, redness due to an increase of blood flow, and the area where the injury is becomes tender to touch, and impaired functioning. Also, there will be a decreased range of motion. If the injury is bleeding, then the following process will happen. Platelets in the blood will be activated by a chemical reaction, and the platelets in the blood make the blood sticky, and this causes the blood to clot. Blood clotting is important because then it means that the bleeding will stop. This process is known as blood clotting. There are two types of hematoma: intramuscular hematoma and intermuscular hematoma. Intramuscular hematoma is when there is damage to the muscle causing blood flow within the muscle belly. However, for intramuscular hematoma, the bleeding doesn't seep into other surrounding tissues, it just occurs where the injury is. In comparison, intermuscular hematoma is when there is damage to the place of the injury and surrounding areas. This means that bruising and damage can spread where the injury didn't occur. However, due to the impact force and shock, other surrounding areas have been damaged. In intermuscular hematoma, the epimysium breaks, whereas in intramuscular hematoma, the epimysium doesn't break and stays in shape. So the healing process would be inflammation. So inflammation is the start of the healing process. Um, then the repair phase occurs a few hours after injury and can last up to 6 weeks or even more depending on the injury. Uh, and then the remodeling phase, where the strength and range of motion of the injury will become natural. So most injuries take 4 to 6 weeks or 6 to 8 weeks. However, if you have an injury such as an ACL rupture or something to do with an ACL or more ligament damage, then some of these can be 6 to 9 months. And I'll come on later to an example of that later on in the presentation. So, if care is given, long-term scarring will decrease. So scar tissue development will imitate the original structures prior to injury and strengthen where the injury was, and range of motion will improve at the site of injury. So they're the physiological responses. The next is psychological responses. So what is a psychological response? So a psychological response is the mental aspect of how an athlete copes or comes to terms with their injury or treatment. And this can affect athletes in many different ways, and also depending what time of year it is and what sport it is. So, um, for example, I'm going to use Phil Heath as my example, who you can see in the middle here. So, motivational issues for Phil if he got injured. Phil getting an injury would decrease his motivation because then he would have to do another whole year of prep and training to be able to get to the level of competition to be able to win. So maintaining a physique like that in bodybuilding or even building muscle takes years and months, and due to having an injury, reversibility would occur, and therefore that would move on to the next factor of Phil being angry. So he'd feel angry if he got injured during his prep for Mr. Olympia because he has won it 6 years in a row and he wants to equal the record of getting eight. So this would therefore mean that he'd have to compete at the top level for another year, with intense training and nutrition, and it would put him back a year. So he's getting older, so building muscle and maintaining it is becoming harder. And also he would have decreased confidence of lifting heavy weights, because lifting heavy weights for long periods of time can injure muscles or ligaments. So if you've already got an injury occurring, then you don't want to aggravate it. So he would have decreased confidence when lifting heavy. And then that would lead on to fear. So he'd have decreased confidence because when he comes back to training, he would be scared of lifting heavy weights in case of hurting the muscle again. This would therefore put his training back and have a knock-on effect on his other attributes, so his muscle and his overall well-being, and it would make him feel stressed due to the fact that he has put hard, intense training in for months and years, and for it all to be undone by an injury, and sometimes they don't know how long injuries will be, and rehabilitation can take very long, especially when you want to get back to lifting heavy weights and maintaining a physique. So now moving on to my examples of injuries. So Joe Marler suffered a lower leg fracture in a game against Sale. The injury happened by another player trapping Marler's leg. Marler is set to be out for 4 to 6 weeks and therefore could miss England's opening game in the Six Nations. When the injury happened, Marler was in a lot of pain and therefore was shouting and screaming as a physiological effect. Also, the area in which he fractured was tender and started to swell. A few days later, the bruising came out and was visible on the skin, and the body will remodel the injury by osteoblasts building new bone tissue and strengthening up the bone. Depending on the severity of the fracture, Marler could face 4 to 6 weeks out of action. So the injury would have had a big psychological effect on Marler, because with the Six Nations just around the corner, the England prop can't represent England. And with Marler just 4 caps away from reaching 50 playing caps for England, and as he is getting older and injuries occur more frequently, the less opportunities he is going to get to represent England, and therefore will damage him psychologically. You'll experience symptoms such as stress, depression, angry, and decreased confidence when going back into big tackles. He'll also be isolated from his teammates because he won't be able to train, and he'll be with the physio and rehabilitation team. So therefore he can just feel isolated and not part of the team, which will therefore increase the other factors such as feeling stressed, depressed, and angry. My second example is Kurt Zouma. So Kurt Zouma suffered an ACL injury whilst playing against Manchester United. Kurt Zouma managed to injure himself by jumping up for the ball and landing awkwardly. As you can see in the picture, his leg is not in a natural position, and the force onto the knee and the position that the knee went into has caused the ACL to be injured. As soon as this happened, Zouma fell to the floor, grabbing his knee and started screaming out in pain, which is the first physiological response. The next physiological symptoms would be swelling, rush of blood to the area injured, and it would be tended to touch. The healing process for the time of the injury will be around 6 to 9 months, because during the fall he ruptured and injured his ACL, which is one of the most crucial ligaments in the knee. However, due to the rate that Zouma progressed at, unfortunately he was set back to 11 months. So being set back to 11 months after being told 6 to 9 months can have big psychological effects. So it would have, so Zouma would have had psychological symptoms such as isolation from teammates. So being away from your teammates for 11 months will be a hard thing. getting back into the swing of things once you come back, missing out on all that's been happening. Depression, frustration, and anger. He would have felt these emotions because of the 2 extra months he was out compared to when they said he would be back in action. However, on the other hand, Zuma would have felt some happiness and confidence after manager Antonio Conte said when Zuma was back from injury and he had recovered fully, he could see Zuma being a big part of the team and a big part of the future. So that was my sports injuries, psychological and physiological responses.